Hi there, how's everybody doing? Wonderful. I'm Kareem Abdullah from CATCA, Community Anti-Drug Coalitions of America, and I'd like to thank the forum for inviting CATCA to be a part of this panel this afternoon. It's really great to be here and to see a couple of old friends and early mentors in the audience, Dr. Hawkins and Catalano, along with our colleagues at SAMHSA. I want to give a special shout out to Rick Hardwood at NASDAQ for being our champion and for inclusion. Today I'm going to spend a little bit of time talking about measurement systems that assess population level change through the coalition context. How many of you, before you saw the agenda, had never heard of CATCA? Well, that's good to know. We have some work to do. So let me take just a few moments to share with you who we are and our definition for coalitions, which we'll be using as an operating working definition today. CATCA is a nonprofit organization based in Alexandria, Virginia. We were established in 1992 as an outgrowth of a presidential advisory drug council. We support data-driven strategic planning and prevention of drugs, alcohol, tobacco, and other drugs for coalitions around the United States, in the U.S. territories, about 5,000 community coalitions and affiliates nationally. And we work building community coalitions in 29 countries globally on 5 continents. When we think of coalitions, we really are talking about a formal arrangement, an agreement made for cooperation and collaboration with agencies and multiple sectors of a community who are all coming together to really bring about population level reductions for our work in substance abuse rates. The Coalition Institute is the arm of CATCA that's responsible for providing high-level training and technical assistance, innovation and outreach, and evaluation and research for coalitions that we are engaging with. The Coalition Institute was established in 2001 as a part of the Drug-Free Communities Support Act. We are housed at CATCA in Alexandria, and we really are charged with making coalitions smarter, faster. The Drug-Free Community Support Program is our largest base of grantees that we are responsible for being the primary training and technical assistance provider for, and that program has been invested in through Congress at the tune of $1.16 billion since 1998, and there have been approximately 2,000 coalitions that have been funded, and CATCA has had the good fortune of working with these 2,000 coalitions across time. Today we're going to really kind of spend a little bit of time thinking and looking at the Institute's framework for community change. And this is going to drill down to the part of the research that shows that one of the important indicators for achieving population level outcomes is engaging in essential processes and having the capacity to do so. And one of the areas in terms of capacity is communities need to really be able to assure the use of training and technical assistance. And our model shows, and we've had a longitudinal evaluation that shows that institute training and technical assistance then triggers enhanced coalition capacity. Once coalitions are able to improve their capacity through knowing what they need to know, what they need to do, and the products they need to produce to guide their work, then they're able to engage in planning mechanisms that allow them to implement essential processes leading to a set of comprehensive strategies. A set of comprehensive strategies are absolutely required if, in fact, you want to create community change that resonates at the population level and to achieve population level outcomes. This is a model that's used by CATCA in the National Coalition Academy, which is a training mechanism through which all drug-free community support grantees in their first year of funding are required to attend and participate. A very comprehensive 3 week residential program supported by distance learning in between, where entire communities can be trained through this use of technology that we find now almost something we can't live without in our work and in our personal lives. So we have made the opportunity available to our coalitions to use technology to do so. Coalitions really do work at promoting health and wellness, and these coalitions are funded specifically to bring about reductions in substance use rates for young people and over time for adults throughout the nation. That holds true also for all the coalitions that we have developed in these 29 countries that I mentioned earlier. So when we think about how do we get to population level outcomes, what we have discovered through our research and the evaluation and the study of our model is that communities really need a problem-solving process in order to be able to ask the critical questions and to identify ultimately the local conditions on which they need to develop a comprehensive set of interventions that ultimately then tap on the risk factors or those causal factors, and then on the back end reduce the problem behavior. So often through our work we've found that communities start with the problem and begin to work at the level of underage drinking as a large problem, or marijuana use in their community as the largest problem, and begin to develop strategies there. We have been successful in documenting through this study that it's important that you really develop your strategies at how that problem, the level of how that problem looks in your individual community. So we are identifying the problem. We're then asking how that problem, why that problem exists, what are the causal and the risk factors in your particular neighborhood, in your geographic footprint, and then how does that show up in Alexandria, Virginia, versus how does that problem look in Idaho. Very, very different. And then your strategies must be developed at that local condition level. Coalitions do use programs, however, that is not their call to order. Their mission really is to focus on environmental strategies, using programs as appropriate. They're necessary, but not sufficient enough to bring about population level change. And so we're going to, in a moment, take a look at some of the intervention strategies that we align with the local conditions that are then mapped and measured to reduce the causal factors and ultimately the problem behaviors among young people. These 7 behavioral change strategies are the ones that the grantees are all trained on getting to after, in fact, they've engaged with their community in a problem analysis process. They then, as appropriate, choose strategies at the individual level, which are the top 3 there: providing information, enhancing skills, and providing support. And then the greatest impact is achieved when they really focus on engaging in these last 4 environmental strategies: enhancing access or reducing barriers, changing the physical design within a community, as well as changing consequences or incentives, and then ultimately the lasting and long-term effects are really achieved when they're able to modify or change policies and practices, whether formal or informal. The one thing that we've been able to demystify is the fact that you cannot just use strategy 1, 2, or 4 for a local condition. These coalitions are using all 7 strategies for each of the local conditions they've identified. So if the local condition is that young people are gaining access to alcohol because merchants are not carding, then they would develop strategies for that local condition using all 7 of these behavioral change initiatives. The research that we've done through our independent evaluation that's been conducted since the establishment of the Institute, beginning back in 2002 when we became operationalized, has been conducted by Michigan State University, Dr. Penny Foster Fishman. And I wanted to take a moment for us to just kind of look at some of the things that were done in this longitudinal strategy. The methodology was a time series analysis, and this sample group were those DFC or drug-free community coalitions who were funded in the 2008-2009 fiscal year. The protocol that was used for data gathering and for matrix and measurements was CATCA's annual survey of coalitions. The annual survey of coalitions is the largest database of coalitions, documenting a coalition functioning, the strategies that they implement, their organizational structure, their leadership, along with the achievements and the results they've been able to gain around population level reductions in rates as it relates to alcohol, tobacco, marijuana, also prescription drugs and over-the-counter drugs also. We did a data collection in 7 waves over 4 years. In year 1, we established the baseline, and then we revisited the data collection process in 6 more waves. The time trend for the community changes were reported by coalitions, again, some using the annual survey of coalitions. We also had focus groups with coalitions. We engaged in interviews with coalitions, as well as with the community partners and federal partners as well. These are the results. Overall, the percentage of coalitions who engaged in creating policy changes grew significantly between baseline and 3 years post their Coalition Academy training. The other thing that was really significant was not did they only grow the number of policy changes, but the coalition involvement and the different types of policies continue to emerge within 12 months after the training itself. So this, the research by Michigan State further documented that the training by CATCA actually triggered the policy changes, as well as policy change being a major indicator for positive youth behavioral outcomes. One thing that was really significant here is that in this, from baseline in 3 months, after the training, they began to realize policy changes or modifying policies in their work, which continued. If you notice, there was a drop at year 4 after based on the baseline. And what this did was inform us that these coalitions at this stage needed additional training and technical assistance, and in many cases, they needed to revisit their logic models and their collective work and began to focus on new local conditions because they had achieved success using the strategies that they had in place for the local conditions that had been identified. The question then became, to what extent does CATCA's framework for change explain this process? And what the explanation showed was that when we look at the training and technical assistance, it actually it did trigger coalition capacity, which then triggered essential processes engagement, where coalitions actually worked using that strategic prevention framework that Robert shared with us earlier today. CATCA was the organization that was asked to calibrate the SPF for coalitions by SAMHSA, and so all of the strategic processes and core competencies that coalitions engaged in ultimately allowed them to be able to have the capacity to develop these comprehensive strategies addressing local conditions and ultimately bringing about the community changes that they had identified in their strategic and action plan that had been informed by their local data. The next question was, to what extent does the pursuit of CATCA's problem-solving approach have as an impact on youth substance abuse rates? We did, the methodology was we used a coalition sample, and the population was combined middle school and high school students, and we looked at outcomes for perception percentages, where parent disapproval, the perception of risk of substance use, and past 30-day use for alcohol, marijuana, and tobacco. And here we found, again, that coalitions who really engaged in a coalition approach using a community problem-solving process had better outcomes. The National Drug-Free Communities Cross-Site Evaluation is conducted by ICF International, and they have been able to document that communities who have drug-free coalitions, who are engaging in this type of training and technical assistance using these approaches, have better behavior outcomes than communities without DFC coalitions. They also have lower rates of substance use than the national average. These are some of the typical coalition evaluation measurements and measurements that coalitions are looking at in terms of their output. They're looking at and measuring their community change, whether they be new or modified programs, policies, or practices, the services that are provided as appropriate based on their members' sphere of influence in being service providers, the type of resources, the amount, whether it's in-kind or real dollar resources, and the networks that they're able to develop along with media coverage. There are a number of findings, again, going back to the fact that policy change and community change was the major production as an outcome based on the framework. And we ultimately were able to determine that based on the complex nature of communities and coalition work, which really can be messy and can be, really needs to be long-term, that we really need to have the three components of a measurement system. Simple, where there may be linear logic models. It needs to be complicated. Dynamics needs to be considered, where multiple coordinated pathways are part of the outcomes, and very complex. So we've got to look at the complexity-based theories for both action and change. In conclusion, according to the White House Office of National Drug Control Policy, looking at all of these coalitions, and this would be an example of all of the sectors that are involved in local problem solving, coming up with local solutions using the 7 behavioral change strategies. DFC coalitions and the work in their community really does have an impact, and that the prevalence of youth substance abuse increases or decreases based on the perception of harm and use. So thank you so much for your listening.
So first I would say, wow, what incredibly interesting, powerful presentations. Let's give another hand to our presenters. Now I'm faced with a big dilemma because it's lunchtime, and we could also easily spend a half an hour on questions. My inclination would be to dispense with the questions and have people answer questions over lunch and in the discussion groups in the afternoon, unless there's a couple of particularly pressing questions that people want to ask now. Okay, Hendricks, do you want to say a word about what we're doing? What we will do after lunch is come back here, or actually no, we'll go to the 3 breakout groups. And Morgan, do you want to say where they're going to be, or?
So lunch is now available outside of this room. Starting at 1:30, forum members and workshop attendees will meet in breakout groups, and in the handouts that we had on the registration desk outside of this room, we had the breakout group assignments. If your name is not included on that list, we have room in each group to allow you to join whichever group you choose. So you're welcome to do that. The groups will meet in rooms located on the opposite side of this floor of the building. So just walk directly that way and you'll see the rooms. Yeah. And then the groups will meet for about an hour and 45 minutes. Yeah. Everyone has this, though. And then return here at 3:30 for the group report backs. That will be done by the chair of each of the 3 groups. Okay.
One last round of applause.